Hello, everyone. Welcome. Dr. Mandell here with you. We're going to move this off. I want to say hello to all our listeners out there. This is going to be a very thorough, interesting program. There is so much to say about this particular topic, but I'm going to cover it in depth, and I hope you will stick around and watch us. We are actually broadcasting live worldwide right now, streaming as we are. Notifications are going out as our chat rooms are filling up. So the topic today is about the medical reasons, the many medical reasons, why women shouldn't want bigger breasts. Now, obviously, our title says bigger boobs, but breasts, whatever you like to say, there's a lot of vanity that goes involved with how women or men look. And this program, please, in all respect, is not about pushing anyone up against a corner, nor saying what is right or wrong in your life. My job today is to just bring out facts to you, to get you to realize that this can be a very dangerous thing, because you're under the knife, you're under anesthesia, you have a foreign object inside your body, you're carrying on your normal daily activities with something that potentially can cause harm or complications. So, hello everyone in the chat room, I want to say hello. So let's go ahead and let's move forward because as I say, this is a very complicated, in-depth type of thing. Now, guys, I invite you to leave comments on my channel under the video. If it's now or a month from now or a year from now, I'm sure that many of you will leave comments. And women, you can leave comments as well. But first of all, let's talk about what's going on here in the United States, in Europe, through many different countries, like particularly Medellin, Colombia stands out with me. Brazil stands out with me, as well as worldwide. Many countries go to certain countries because it's inexpensive to get this breast job, and today more is saline. The old used to be silicone back in the early 80s, but people still have silicone within them. But let's just go on to a few different things. Now, women, I realize that, we get these, when I say we, women, these types of cosmetic surgeries done for reasons. And obviously, it's to look better, feel better, improve, build up self-esteem, or some type of vanity that you have, some thought that you're trying to get better within your life, or maybe get looked at more often, or maybe get picked up or taken out. I don't know. But regardless, I just want to bring out, this is a multi-billion-dollar business, and it's happening every day right now more than anything. Back in the old days, it was the nose job, it was the septums, and it was this kind of stuff. They're still doing it, Beverly Hills, California, but the breast augmentation is the big one. According to the National Institute of Medicine, 25 to 40% of people who get breast implants end up needing another operation to correct it sometime in the future. That's a given. And as I go into some stats with you and some different things with you, you're going to really step back and you're going to say, wow, all these contraindications that potentially could be happening to my life, my body that God has given me, is it really worth it? So I'm not here just going to be picking on breast augmentation. I'm going to be teaching you a little bit about other conditions that you could be affecting neuromuscularly, musculoskeletal-wise. But the primary jut of it is obviously, if you want bigger boobs, you're not getting it at the gym. You're not getting it from food. You're not getting it from salt. Nothing's going to make you swell that much but plastic surgery. We all on that same wavelength, I hope. So we realize that surgery, when it's given into fatty tissues, there are dangerous infections that can occur. Understand that the fatty tissues are more dangerous than the lean tissues. And we are in a fatty tissue. We are around lymphatics, which is a huge thing in the body. lymphatics travels, if anything gets infected, you can become very sick, ill, and potentially die. I know about 3 cases where there were complications, serious complications from infections to anaphylactic shock of anesthesia. So just from anesthesia and other factors besides the surgery, you are setting yourself up potentially to a problem, we'll say. So realize today most of the implants are saline. I'm sure they are using other types of materials as well in different countries, maybe a type of a plastic, or generally more commonly under the muscle. You'll find women who dance at nightclubs, they usually put it over the muscle just to give it more of a fluff feeling. Let's go ahead and just show you another one, because obviously I do have some things to show you. Now, guys, you may be saying, wow, okay? And listen, we're not taking away beauty. That's not what this program's about. We're here just to understand that the reality of what goes on out there is reality, and we have to accept it, but we have to learn the facts about it. So the key thing here is when a person has this type of surgery, there are many different risks. And I'm going to go into these risks, from rashes to skin problems and neck and back problems to breathing difficulties, problems with their postures, problem with sensitivity of the breast or the nipple. You lose sensitivity because you are getting nerves being severed. Those peripheral nerves are being severed around the nipples, and that area never comes back. Very seldom it will come back. Once those nerves are severed, you are looking for potential problems because you're not going to have the same sensitivity. I don't care what your doctor tells you. I can tell you that when many of these nerves are severed, they just don't come back, okay? Because there are nerves that are severing that are not being repaired while they're being severed. It's not like you broke a wrist and they correct the nerve as they correct the bone. Realize it doesn't work that way. It's a little bit different here. There are definitely a lot of psychological things that go on with this condition. As we talked about infections, the surgical risk, the anesthesiology, the anesthetic risks. We're looking at chronic breast pain, okay, from complications, scar tissue that can actually come over the implant and grow over the implant. And obviously the purpose of scar tissue is to repair certain people keloid worse than others. And that scar tissue doesn't have flexibility and durability like normal collagen tissue does. We can get somehow hardened areas of calcific changes, necrosis in there because it's lacking blood circulation. Dissatisfaction, which I'm going to show you this. I'm just starting here. Disfigurement, which I'm going to show you, but you're going to see one breast looking much different than the other. You're going to see scars that you really don't want to see. And this can lead to lots of different conditions, which I will touch on. I'm just trying to skim the surface here because I have so much to say, and I want to say it pretty quick. Studies show that silicone breast implants suggest that most implants last 7 to 12 years. Some break during the first few months or years, while others last more than 15 years. As we say, people out there still have their silicone. The other thing is that when you get these implants, many of you will get them when you are not at your ideal weight. I recommend that's a no-no. You better get to your ideal weight first before you do that, or you're going to be sorry later. Because as you lose weight, you're going to say, what happened? Because a great deal of your breasts are fat. And if you lose weight, you are losing fat. The other thing is the bounce factor. What happens is when you have more weight, and I'm talking about like a D cup, anywhere up to 15 to 23 pounds. So a C cup is about, in my opinion, maybe 12 to 17 pounds. That's a lot of weight. I don't know if you ever bowled before, but picking up a 10-pound bowling ball, imagine it's on your chest, and you can imagine the stress of what is being taken place, which I will go into that with you in just a few minutes. But the bounce factor, that when you're bouncing, you're jumping, you're running, all of that is stretching. You're getting anywhere from 5 inches of stretching on a 38D to anywhere from 3 inches stretching on a normal breast, a smaller breast. 3 inches stretching. That's pulling on that collagen tissue. So realize you're looking up to 23 pounds of weight in a D. And so if you do the cups backwards, C cup, B cup, A cup, you can kind of estimate the weight of your breasts. And obviously, you know when you have heavy breasts. You know when you have heavy breasts. You can just feel it. No one has to tell you. So many people who have this sweat more profusely because of the, we'll say, built up, you could say, fluffiness in there. That's a common thing. People get rashes, very, very common. It affects your normal running, your jumping. It can affect your sexual pleasure, and I'm not going to go into that, but there is more juggling, there is more flapping, there is more swinging. Guys, you may be liking this conversation, but let's be adults right now. Gravity is not your friend. When you have excessive weight in the breast, even without implants, gravity is not your friend. It's just not your friend. It wants to fall. It wants to stretch. And when that skin stretches, you can't fix that. And that's more surgery, and you're risking more problems. So I just want to give you the underlying basis. For example, a lot of the things that doctors are using today, you can't really intervene and do mammographies clearly and look at what's underneath that particular silicone or that particular plastic. You're missing potential problems and screenings for your health and for your life and for your future that you may not be able to see it because this is actually being obstructed. So that is something important that you should keep in mind. My biggest problem with these things is repetitive surgeries. Repetitive surgeries have a lot of potential risks, and that's what I really wanted to bring out pertaining to that. So let's go on to a few different things, and then I will come back and give you some important facts about augmentation. Understand that plastic surgeons are not going to give you the facts. If you have a hefty pocketbook and you can afford their surgery, they are going to recommend surgery for you. I don't think I ever heard of a doctor, unless it was like a significant problem, like if you had significant cancer, you had breast removal because of cancer or something like that. Realize I'm not pertaining this program towards any sickness nor disease. These are healthy individuals who choose to make a change for their life because of some vanity that they have within them or something within them that wants them to feel better or look better or have more self-esteem or look more sexier or whatever it is. But I want to stay respectful with everyone out there that this is not me against you, me against anyone. This is just me coming out with facts and research so you can understand the contraindications and weigh them out so you can have a healthier potential life in the future. So let's move forward here. This is a little something that I don't mean to be funny nor sarcastic, but we just want to give you the understanding of weight. Sometimes it's easier to see something like cantaloupes or whatever you want to call it, or coconuts. It's easier to comprehend things when you can see it than when you can't. All right, so realize they do have weight. All right, so if we go into this particular position, this picture, this is a significant deformity, quite common. I have seen many of patients. No, I'm not a plastic surgeon. I am not a surgeon. I'm a chiropractor, but I've had the opportunity to see thousands, many thousands of people, and many of them are females, and many of them have communicated with me. And there are people within the family who've had issues and cousins, and I have a lot of experience. I have a dear friend who's a plastic surgeon, so I have more experience. So that's why I am talking about this. So this is quite common because of scar tissue. If you have keloids, if you cut your skin like this, more common in darker people, but if you cut your skin and you see a real thick scar starting to occur on the outside of your skin, the same thing happens inside your body. So when there is surgery and you're cutting through tissue and the body's correcting it with fibrous tissue or scar tissue, that scar tissue loses that durability, that continuity, and that scar, that real thickness of that scar starts to cause that deformity from that tight scar that goes on. Quite common just from surgery. That's why there's a lot of failures in surgery. Here is another thing that an insert that was defective, that happened inside someone's breast. And I can show you over and over many different ones, but I don't want to go too much into that. But if you look at these scars, you are going to have scars. And some people are going to be a lot worse than others. And those scars can be painful. And it can affect, you can develop scar tissue over depending upon where they put the saline or whatever they're inserting in there. You can develop lots of scar, lots of pain in the chest area, difficulty breathing. Let's say exercising. If you lift your arms up high or you stretch the chest and open the chest up and you've got scar tissue in there, very, very painful. Okay? Very painful. So when we look at those scars, that is reality. Now let's go ahead and look at this. Obviously, lower back pain is quite common with this because of the fact that with excessive weight, we will develop, I don't want that one right there. How'd that happen? We will develop this particular condition. It's like an upper cross syndrome. We will develop the rounded shoulders, the forward head posture, the tight pectoralis major and minor. We will notice a lot of weakness in the lower trapezius and a lot of weakness inside the rhomboids. We'll notice kind of, look at my shoulders, kind of this, rounded, because the breasts have weight. And most women who have breasts, even smaller breasts, generally have poor posture because they have weak rhomboids. If I take you here, we say weak rhomboids. These are the muscles between the shoulder blades. And these muscles are significantly weak, causing that rounding of the shoulders, forward head posture, and that will lead to many conditions like going down the neck, into the shoulders. Here's another condition, rounded shoulders. And this lady's breasts are, fair to moderate, I would say. I showed you the other larger breasts, but the rounding of the shoulders will cause lots of problems. Here's another picture here of the rhomboids. You can take a look at this, and these muscles are the weakest muscles called the retractor muscles. So women, even if your breasts are beautiful, and they all are beautiful, regardless of the size, you should all be doing rhomboid exercises. That's a very, very important thing. Here's more scarring here. This was a picture of an infection that happened after the surgery. Not good looking, but I have to show you that. Neck problems, very common. Heavy breast will pull the shoulders forward. The traps will actually pull forward. The head will go forward. Very common with pain down into the arm, tingling, numbness, cramping into the chest, affecting your breath because when you're forward like this, you can't really inspire and open those lungs. So remember, we have a beautiful looking person here. Look at this lady right here. I mean, wow, that's stunning, right? But those are large breasts. I mean, those are over D's. I don't have to measure those, trust me. And yet she's very sexy, very pretty, but remember, you got 4 to 5 ounces, 4 to 5 inches, not ounces. That's a lot more than 4 to 5 ounces, but 4 to 5 inches up and down, up and down. That's a lot of tugging on that soft tissue. All right. And a lot of women who get augmentation are at the gym. I mean, I see them all the time. All right. They're working out. They're jumping. They're on the treadmill. They're running. Okay. Realize what you're doing to your body. You cannot hold up a bowling ball and just run with it. You just can't do it. It's a lot. It's a lot on your body. Posture is so important. You can see the rounded pronated shoulders as a result of that rotation going on there. So I wanted to just show you what that looks like there. So here's another very common thing that we see. It's called a dowager's hump. A lot of females, more females get this than males. Now, you may notice from your posture, having the breasts, bigger breasts or smaller breasts, sitting on a computer, looking down all day. When you start going forward like this, you start rounding out, you may notice behind your lower neck, upper back area, you see this little hump. Okay, we did a video on dowager's hump. You should go ahead and look at that on my channel. But this is very, very, very common with breast augmentation. Very common. This is a very serious problem. These things can only get worse if you don't take care of it. This is a very serious problem. And you can look good here, all right? But you can look horrible here, what would you rather have? Would you rather have a healthy spine, which is your lifeline? That's the nerves that controls your whole entire autonomic and parasympathetic autonomic system, and it controls everything. That's most important. That's your lifeline. So I'm trying to get you tuned in for a reason, not because I like something one way or the other. I just want to see you feel healthy. Very common intercostal neuritis, pain between the shoulder blades, burning in the shoulder blades from that rotated shoulders. Very, very common. We see that quite often. Very common. So let's get back into, and I'm going to leave a picture on here because I'm sure I'm going to get a few people popping in this chat room right now, and I'm sure you're going to get people looking at this. So I'm going to go ahead and I'm going to leave something up here, and I'm going to leave something right there. Okay. Let me just go into important things about these breast implants. Number one, always additional surgeries. Mostly always, I can promise you. Especially when they start to sag, when they start to fall, when they start to get deformed, when the saline starts to maybe leak or something happens, or your body actually rejects it. You'd be surprised. A lot of bodies reject certain things. That is a foreign object. You get a capsular contracture around there. That capsular contracture, you can get scar tissue that starts to form around the implant, and it can squeeze on the implant. It can squeeze. The scar tissue can actually squeeze, causing you a lot of discomfort, breathing, moving, twisting. And it doesn't feel good when you touch it or someone else touches it, because you're killing the nerves. You're developing scar. You people out there may have the vanity of saying, okay, I look healthy, but maybe you and your boyfriend or husband or whoever you're with, you don't feel right when they touch you, because it doesn't feel right when you touch yourself. So because of this going on, you may look great in clothes, but deep inside you may be saying to yourself, because I know many people who end up taking their implants out because of these consequences or these situations that affected their life with other people, with maybe yourself, maybe your boyfriend, your husband, or girlfriend. It doesn't matter. Today we live in a different world, but you just need to feel comfortable about yourself. You need to feel loved about yourself. You need to feel special. And if you don't have that feeling, that good feeling inside yourself, you're going to take them out. You will take them out because it's not you. It was your decision. It may be someone who decided to put tattoos on your body, but now you're saying, you know what? The tattoos aren't for me. I want to get them burned off. I want to get them lasered off. So that's why I'm trying to outweigh this. Now, if you are very heavily breasted and you are having back pain, which is quite common, or neck pain, breast reductions is different. We're not putting something in there in a breast reduction. We're just taking excessive out to make it less of a load, to put less stress on your spine. You with me? Changes in your nipple and breast sensation, extremely high. Breast pain, very high. And, as I say, ruptures, and you may not even have symptoms as you're getting a leak. So those are some very important things. Now, these are the complications. One of the most common ones is asymmetry, where they're uneven, and very, very common. I would say it's one of the most common ones. Maybe the size, the shape, the texture, the way it feels. Breast pain in the nipple and the breast area. You may have atrophy, so maybe some shrinking around the skin. Calcification, quite common. People, sometimes mistaken that for maybe being cancer. But as a result of these hard lumps, the body can calcify it. It doesn't know. The body's recognizing it as a foreign object, and it may be calcified. So those are some other things. You have capsular contracture, as we talked about, the firmness of the breast. As the scar tissue grows around the implant, you can get that contracture in there. And then let's say you just move your arm back and or you go up like this, or it's affecting your life. That's a time where you really need to think twice. Your chest wall, it can affect the chest wall. There are things that can happen. We talked about deflation. If it's saline, it does happen quite often. Extrusion. I knew someone else recently where they noticed it was kind of coming out the skin. It was kind of scary. I saw it. It was actually extruding. The body was actually just pushing it out. And it was like all colored, and it was like oozing out of the skin. And she never damaged herself. She didn't cut herself. The body's trying to excrete it by itself. That was crazy. But it happens. It's quite often. We talked about infection, reacting to this, inflammation, irritation. If you're noticing redness, swelling, any type of loss of function, it may not happen right after. It's going to happen months or years after. But it happens because the body decides, hey, I don't like this. Necrosis. You may start developing dead skin around the breast. Now, obviously, if you're on steroids or you've had some other chemotherapy or something else or radiation, that can affect it. So I want you to just keep that in the back of your mind. The palpability. In other words, you may be feeling something, the implant, that you never felt before. That's scary. You're saying, I didn't feel that. Well, obviously, you need to go back to your surgeon. That happens. So we talked about sagging. A rupture can happen in there. You can actually get blood in there if you're getting swelling or bruising. They call that seroma. Skin rashes very commonly. Visibility, as I say, the implant can be seen sometimes through the skin. And the sagging with the skin, as we talked about, that can really cause that stretching. Because what do you do when you have all this weight, now the breast is down to your knees? You know, I'm not going to tell you what to do, but I'm just concerned because I've seen it, and you just need to be very concerned about yourself. So there is a lot of information when it comes to FDA about gel-filled, about connective tissue problems. The FDA has not detected any association between silicone gel-filled breast implants and connective tissue diseases, but there are other things I gather they have connected it with. On silicone, there can be problems with breastfeeding, by the way, if you have implants. The doctors may say no, but yes, there can be problems with the glands and how things are actually producing milk. I can tell you it is true because I do know some people that had problems. Otherwise, I hope that this information was quite somewhat educating. It was to me. I asked people out there to hopefully share these videos. I think we had enough pictures. I'm not going to go ahead and put up any more pictures out there. I ask you to subscribe to my channel. I have many great self-help videos out there from forward head posture to herniated disc to knee, neck, shoulder, many on neck problems, much on nutrition. This was just something where I just had to come out and break through. You know, I've been wanting to talk about this a long time. I've seen a lot of this, and people in my family have been through this in the past, and it's a very touchy subject. And in all respect, I don't really want to put any harm between you and I, nor any harm between any of our chat people. Or this is not a debate. This is just something that we need to make good decisions in our life. I really hope you enjoyed this program. I ask you to share my videos. You can contact me on Facebook, Motivational Doc on Facebook. I ask you to like that page. Leave your comments below as well. There are going to be thousands of people that are going to respond to this video. I promise you. Sex sells, and when they see anything about sexiness or breasts or girls or males, people do crazy things. All right, so I send my love out to all my chat room listeners who've been following me, and I really thank you very much, and I send my love out to all of our listeners as well. Much love to you, your family, and good health, and we will catch up with you real soon. All right, good day or good night wherever you are worldwide. Bye-bye now.